Introduction. N-dimethyltryptamine, DMT, is an endogenous serotonergic psychedelic capable of producing radical shifts in conscious experience. Increasing trends in its use, as well as new trials administering DMT to patients, indicate the growing importance of a thorough elucidation of the qualitative content, over and above structure, which the drug occasions. This is particularly in light of the hyperreal, otherworldly, and often ontologically challenging yet potentially transformative nature of the experience, not least encounters with apparently non-self social agents. Laboratory studies have been limited by clinical setting and lacking qualitative analyses of experiential content, while online surveys' limitations lie in retrospective design, uncontrolled use, and both of which not guaranteeing breakthrough experiences, i.e., producing very strong psychoactive effects. Methods. We report on the first naturalistic field study of DMT use, including its qualitative analysis. Screened, healthy, anonymized and experienced DMT users were observed during their non-clinical use of the drug at home, 40 to 75 milligrams inhaled. In-depth semi-structured interviews, inspired by the microphenomenological technique, were employed immediately after their experience. This paper reports on the thematic analysis of one major domain of the breakthrough experiences elicited, the other. 36 post-DMT experience interviews with mostly Caucasian, 83% males, 8 female, of average 37 years were predominantly inductively coded. Results. Invariably, profound and highly intense experiences occurred. The first overarching category comprised the encounter with other beings, 94% of reports, encompassing superordinate themes including the entity's role, appearance, demeanor, communication, and interaction, while the second overarching category comprised experiences of emerging into other worlds, 100% of reports, encompassing superordinate themes of the scene, the contents and quality of the immersive spaces. Many further mid-level themes and sub-themes also illuminate the rich content of the DMT experience. Discussion. The present study provides a systematic and in-depth analysis of the nuanced content of the otherworldly encounter within the breakthrough DMT experience, as well as elaborating on the resonances both with previous DMT studies focusing on entity encounters and other types of extraordinary experiences entailing such encounters. These include the alien abduction, folkloric, shamanic, and near-death experience. Putative neural mechanisms of these features of the DMT experience and its promise as a psychotherapeutic agent are discussed in light of such findings. Introduction. DMT, the spirit molecule. N-dimethyltryptamine, DMT, is an indole alkaloid and potent serotonergic psychedelic, acting on the 5-HT2A receptor, which is virtually ubiquitous in nature, McKenna, 2018, and endogenous to humans. Reviews of its detection in the urine, cerebrospinal fluid, and blood of human beings points to a maximum possible endogenous concentration of 55 ng/ml, Barker et al., 2012. Dean et al., 2019, have evidenced the presence of indole ethylamine methyltransferase, INMT, a key requisite enzyme for DMT synthesis, in the human cerebral frontal cortex and pineal gland. DMT is one of the major active constituent in the Amerindian shamanic decoction, ayahuasca, vine of the dead, typically blending the DMT concentrated Psychotria viridis and Banisteriopsis copy that contains the beta-carbolines rendering DMT orally active. DMT ingestion amongst humans has a potentially ancient history. It was identified, alongside harmine, one of the other ayahuasca beta-carbolines, in a ritual bundle from the Bolivian Andes dated to at least 1000 CE, Miller et al., 2019. Use of DMT and similar compounds, 5-MeO-DMT and 5-MeO-DIPT, in contemporary society, at least in the United States general population, is relatively rare at 0.7%, Palomar and Liu, 2018. Research slightly prior to this finding suggests that its use may be increasing, as a larger proportion, 24%, of DMT users were identified as new users compared with other psychedelics, Winstock et al., 2014. With its physiological role yet to be clarified, Rodriguez et al., 2019, given its profound psychoactivity as well as proclivity to engender subjective experiences of sensed presence, or interactions with other than self-social agents, it has been suggested that DMT models or may be implicated in a host of altered states ranging from dreaming or psychosis, Dean, 2018, to spontaneous transpersonal experiences such as alien abduction experiences, Luke, 2012, or near-death experiences, NDEs. Strassman, 2001, Timmerman et al., 2018, DMT's precise qualitative relationship with which will be the dedicated subject of a subsequent paper. Not many studies have been dedicated to systematic qualitative analyses of the psychedelic experience more generally. Example: ayahuasca, Kjellgren et al., 2009, Wolf et al., 2019, psilocybin, Turton et al., 2014, ibogaine, Skenberg et al., 2017 b. See below re, DMT. While some have explored the subjective mediation of psychedelic therapy, example ayahuasca, Loizaga-Veldier and Verez, 2014, Dos Santos et al., 2018, psilocybin, Belser et al., 2017, Watts et al., 2017, ibogaine, Skenberg et al., 2017 a. LSD, Gasser et al., 2015. Beginning with a surveying of DMT use in modern and indigenous Australia, Tremaci, 2006, there has been a recent surge in interest in the phenomenology of DMT, including its cultural history, and the Gnostic insight and essential liminality that is defining of the experience, St. John, 2015, 2018, John, 2018. The remarkable consistency in many of its motifs has been noted, Gallimore and Luke, 2015, including the nature of the encounters with entities, which is itself a subtopic of significant attention, with direct implications for mechanisms of social cognition, and possibly for ontology, Luke, 2008, 2011, Luke and Spowers, 2018. Varieties of DMT experience. In April 1956, Stephen Zara self-administered DMT intramuscularly, IM, representing the very first human experience with pure DMT, and at 1 mg per kilogram reported sensations such as brilliantly colored oriental motifs and wonderful scenes altering rapidly. Zara, 2014. The study of Holish et al., 1958, constitutes the very first research study in human participants, and used 0.7 to 1 mg/kg IM DMT in 30 healthy individuals. The report divided the experience into course and pathological categories, as symptomatic of such early DMT studies, including with patient populations, Bosser-Menei and Zara, 1958, Turner and Merles, 1959, saliently however, incorporating anxiety, qualified with the statement, when the world changes so suddenly and intensely that the subject loses his solid environment. Holish et al., 1958, page 9. Strassman, 2001, in one of the first landmark psychedelic studies post-prohibition, documented the experiences of 60 participants undergoing over 400 DMT doses, which resulted in at least half of the high-dose, 21 to 28 mg/kg, IV, participants reporting otherworldly adventures with other beings, Luke, 2013, a closer content analysis of which will be the focus of a subsequent paper. Constituting the only other thematic analysis of the DMT experience, Cott and Rock, 2008, coded 19 narrative reports from an online survey, with a sample of mean age 23, SD equals 6, 95% male, and time since last DMT usage ranging from 2 days 11% to 2 years 5%. 20% were previously DMT naive, 5% having used DMT greater than 100 times. 9 very generic themes were identified, as follows: hallucinations, which were visual, bodily, or auditory; veridical hallucinations, entailing transportation to another world and supplanting of ordinary experience by DMT hyperspace, persistently considered to be true or real, and contact with sentient beings attributed; exosomatic ontological status, affective distortion, distortion in time, space and self, spirituality, denoting descriptions of beauty, love, religious experiences, or insights into self or the nature of the universe; familiarity, denoting a sense of having been in the DMT space before, or even always residing there; lucidity, ineffability, and extreme intensity. Most recently, Timmerman et al., 2019, in the latest laboratory research with DMT, have provided a unique, valuable neurophenomenological study of the DMT experience, in which they illustrate intimate correlations between the phenomenological structure of first-person reports, specifically the visual, bodily, and metacognitive/emotional domains they identified, and real-time neurophysiological measures. like 2019, has conducted a content analysis of entity descriptions specifically. Across 149 online published DMT trip reports, 90% male, mean age 25 years. From 2009 to 2019, which entailed 180 entity encounters in total. Comprehensively, Davis et al. 2020b undertook an international survey, encompassing 2,561 respondents reporting encounter experiences after a breakthrough dose of inhaled DMT, that is, one that produced very strong psychoactive effects. 77% of the sample were male, slightly lower than the prior studies, though 85% were Caucasian/white, 64% living in the United States, and an average age of 32, SD equals 9. Respondents had used DMT an average of 14.5 times, and 67% reported that their most memorable entity encounter, about which they are answering the survey, was their first encounter. Other schematizations include Meyer, 1992, which incorporated a hyperspace populated with intelligent, communicative entities in 66.5% of 340 online trip reports. Also see Strassman et al., 2008. Lastly, Shannon, 2002, Anthropological Charting of the Phenomenology of Ayahuasca, whose principal component is DMT, culminates in the transportation to another realm of existence, one which he or she feels to be very real, where also taxonomized are the supernatural beings observable in the ayahuasca world. Specific cross-referencing between the results of these particular studies and the current analysis themes is given thorough attention in the discussion section below. Rationale for the current study. The thematic analysis by Cott and Rock, 2008, and the encounter survey of Davis et al., 2020b are significantly limited in the following ways: underrepresentation of the general population, respondent self-selection, but primarily, small sample size, only the former case, relying on, sometimes triaged, narratives, instead of interview, or fixed answers, retrospective reports resulting in potential memory bias. Deterioration or elaboration, phenomenological versus qualitative analyses. Inability of monitoring or regulation of not only dosage but set and setting and potential contamination of the experience by use of other substances. The present naturalistic field study of DMT use aimed to address almost all of these limitations by performing a large sample, thematic analysis, including content analysis, of a discrete dataset of breakthrough DMT experiences with convenienced sampled participants, extracting rich content by in situ semi-structured interviews, SSI, immediately post-experience. Also, contrasting with prior laboratory studies, Strassman, 2001, reports were based on unsystematic bedside notes after doses, albeit with a large sample size, ranging from 7 to 28 mg IV DMT, and Timmerman et al., 2018. Purely psychometric analyses, N equals 13, resulted from 7 to 20 mg IV DMT with only a subset receiving high dose, whereas this study aimed to analyze only high-dose breakthrough experiences. While the SSIs of this study are consistent with methods in qualitative psychology, it also aimed to employ the bracketing technique, a central function of microphenomenological interviewing, Petit-Mengen, 2006, 2017, Timmerman et al., 2019. This allows for a provision of inductive prereflexivity, that is, encouraging participants to avoid judgments of experiences into predefined cultural categories, such as alien, regarding DMT, which may otherwise lead to propagation of such memes, or confabulating by biased recourse to one's conceptual repertoire, and to instead attentively describe the constitutive features in one's own words. The aim of the present paper is to achieve, via the above improvements, a finer and more naturalistic resolution, and thus greater understanding, of the DMT experience. Especially, the nuances of the qualitative content of the experience, over and above the more gross phenomenological structure, such as Timmerman et al., 2019, C. Varela and Scheer, 1999, Petit-Mengen, 2006, for this valuable distinction, example, the former being of a variable nature and the latter relating to more invariant processes. This is crucial given its increasing use amongst the population, and more importantly owing to the scheduling of the first clinical trials to administer this intense and fast-acting psychedelic to depressed patients, Steiner et al., 2020, D'Souza, 2021, as well as healthy participants, Liechty and Lay, 2020, Scheidegger, 2021. The paper's particular focus lies in the otherly phenomena evoked by DMT, of immersion into different environments which, crucially, gives way to engaging with non-self entities. This is later discussed in terms of similarity with other exceptional experiences, including possibly shared neurobiological mechanisms, all of which may have implications for therapy. While the psychedelic mystical experience has garnered most attraction as predicting clinical outcome, Hygen et al., 2018, Roseman et al., 2018, the profundity of the entity encounter itself has recently gained attention as to its therapeutic potential, Davis et al., 2020 b. Lutkojtis, 2020. Other themes, spanning the particular experiences associated with the self versus other, such as psychological and emotional effects, including experience personal and ontological interpretation and impact, i.e., phenomenological features especially pertinent to DMT's therapeutic capacity, will be delineated in a subsequent paper. Materials and methods. Redacted. Participants and recruitment. Most volunteers were convenience sampled via online, social media advertisement, with many sampled via snowballing. All prospective participants were subject to stringent inclusion-exclusion criteria. All recruited participants were experienced DMT users, with inclusion criteria entailing having taken DMT on 3 occasions, or at least significant other DMT analogous experiences such as ayahuasca or 4-ACO-DMT, with at least one a breakthroughs experience, typically highly intense and perceptually immersive or remodeling, see Table 1. Participants were also required to provide their own DMT supply, exclusively of the form NN-dimethyltryptamine, NN-DMT, hereafter, referred to as DMT, and to live within the Greater London, Sussex or Kent area of the United Kingdom. Participants were selected in accordance with Johnson et al., 2008, Volunteer Safety Guidelines for Hallucinogen Research, with exclusion criteria entailing prior psychedelic experiences which were difficult, i.e., putting self or others at risk, or leaving lasting psychological harm to self. The Structured Clinical Interview for DSM-4 Axis I Disorders, Clinical Trials Version, SCIDCT, First et al., 2007, was utilized by a trained SCID administrator as a screening tool, also excluding those with a current or past history of meeting DSM-4 criteria for schizophrenia or other psychotic disorders, or bipolar I or II disorder, as well as individuals with a first-degree relative with these disorders. Also excluded were those with lifetime presence of any major depressive or manic episode, substance abuse or dependence within the last 5 years, and any other current psychiatric diagnosis. 64 prospective participants were screened, where 39 were finally included, resulting in 47 DMT sessions in the parent field study. 36 sessions were the basis of the present thematic analysis. After removal of interviews not meeting several criteria, such as minimum use of 40 mg DMT,